we appreciate the opportunity to be able to help you to be oriented and prepared to be successful with the PROMPT initiative. So we are doing this condensed kickoff. I think you should see this as an opportunity to ask questions. That's what the kickoff was when we did it in person. So you can feel free always to just type any sort of question you might have into the chat. We will take time here and there also to ask if people have questions. Then you can come off mute and ask them, raise your hand if something comes up. But most people, when they're presenting, usually want to go ahead and get through it and then take questions. But if somebody doesn't want to do that, they will be able to let you know. I am Linda Detman. I am the Associate Director for Programs and Operations for FPQC. And again, really glad that you're here with us. Can you go to the next slide, please? If you've been with FPQC for any length of time, you know that whenever we do any sort of meeting, we like to revisit our vision and values because it really guides everything that we do, and it certainly guides the work that we are about to embark on in the PROMPT initiative, and that's that all of Florida's mothers, infants, and families will have the best health outcomes possible through receiving respectful, high-quality, evidence-based perinatal care. And the values that drive that are the focus on data, that we're population-based, evidence-based, that we center respect in all of the work that we do. Respect not only for the families and the patients, but also for your colleagues and for others in your hospital, and that we add value to your work and to the care that you provide. Next slide. This is the list of the many partners and funders that we have. We are so fortunate to have many professional organizations around the state and some even at a national level that provide support, not always financial support, but certainly expertise and often financial support as well, and just providing people to be part of making the initiatives what they are. Next slide. So here is your PROMPT initiative leadership team. Many of us are on the call today or will be or at this meeting and will be speaking. Your clinical leads are Doctors Cole Greaves, Danielle Cruciat, and Ashley Kane. Your nurse lead is Margie Boyer. We do have a family lead who has had personal experience with hypertension, and she'll be speaking here shortly. That's Mandy Gross. Lori Reeves is on vacation. I'm jealous. She's 2 weeks over in Europe, and so we are missing her today, but I know that she is very excited that we're able to provide this training today. Estefania Rubio is our data, our Associate Director for Data Informatics. She happens to be at a maternal mortality review committee meeting today. Our QI team, Estefania Reyes Martinez and Sarah Steuben. Sarah in particular is the QI lead for the PROMPT initiative. So you probably already have heard from her and will continue to hear from her. She's a point of contact for this initiative for any issue that you may have. And then in addition to Dr. Rubio, the data team is Shelby Davenport and Alexa Muchler. All of us are available to you for any questions. It's usually easiest to reach FPQC through our global email, fpqc@usf.edu. We can always then route questions to individuals, but you will start hearing from individuals, and you can always feel free to reach out to us separately as needed. Next slide. So why PROMPT? Seems like a question that you wish you didn't have to ask. But we do know that hypertension is very common. And I think in pregnancy, also poorly controlled and underreported. It disproportionately affects populations in our state and nationally, in particular, non-Hispanic Black patients. It can cause serious harm, not only just in morbidities, but can also cause mortalities. And it's expensive. It's expensive to deal with as a patient. For hospitals, for insurers, there's a great deal of expense across the board in handling hypertension, and certainly the ramifications of having hypertension issues during pregnancy can go even beyond just monetary expense. Next slide. So why PROMPT? You can see here that hypertensive disorders are the leading cause if you look at data from 2018 to 2020. This is pregnancy-related mortality ratio data from our own Florida Maternal Mortality Review Committee and the Florida Department of Health. So we have some issues in our state related to a number of pregnancy-related conditions, but hypertensive disorders are at the top of that list. Next slide. These hypertensive disorders are the leading cause of pregnancy-related death in Florida, and that's those are deaths that are particularly related to issues surrounding the pregnancy, and that's from pregnancy through the first year postpartum. The Florida Maternal Mortality Review Committee has found that those hypertensive disorders account for 18.2% of all pregnancy-related deaths. And these deaths are preventable. So changes or things that we can do to assist providers can help to avoid these pregnancy-related deaths, as well as in facilities and patient-related factors. But really trying to address things with providers is one way to address the hypertensive disorder pregnancy-related deaths. Next slide, please. Again, we're asking the question, why are we doing PROMPT? And you can see here that from 2017 to 2022, that we've had quite an increase in all hypertensive disorders of pregnancy. Pregnancy-related has gone up. Chronic hypertension has gone up. So unspecified, which I don't even know exactly what that means, is just a little bit. But you can see that it's a problem that is increasing over time. And so it requires some attention. Next slide. So this, I think, is the thing that we often don't think about, because deaths and pregnancy-related deaths are so tragic and difficult to reckon. But it isn't just that people die, it's that they have complications. So for every woman that dies as a result of a pregnancy-related complication, up to 100 experience severe complications. And those complications have ramifications for them, can have ramifications, certainly in the immediate term, but across the lifespan. So it's really critical to be in a position to try to prevent hypertensive disorders of pregnancy and to be able to respond to them appropriately when they do happen. Next slide. So we did FPQC. Some of you may have been around back in 2015 when we did the first go around of an initiative on hypertension. And you can see that over the course of that initiative, we were able to increase the percentage of women that were treated within 1 hour with acute onset maternal hypertension over the course of 18 months of the initiative. There were only 33 hospitals, I believe, that were involved in the hypertension initiative at that time. But they were hospitals that had a large volume. So we did impact quite a number of the births throughout the state. But as you can see from the previous slide, we've started to backslide from 2017 going forward, and the rates are increasing. So it's time, and the time is now. And so we are now working on hypertension again. Next slide. So to answer why PROMPT, we know that it works. It's worked for us before. We know that we used elements of the AIM package. We'll be talking more about that as we go throughout the day today. And we know it's time to act.